And we're on the line this morning with Melissa Duncan, physician assistant to IPG Cardiology, joining us during Heart Month. And our conversation brought to you by Marcus and Mack, a law firm representing injured people. And good morning, Melissa. How are you?
Good morning, Todd. I'm good. How are you?
I'm just wonderful. It's Heart Month, Melissa.
I know. Another February, another conversation on the radio. We do this once a year.
Well, you're invited anytime, but we've got a lot to talk about here this morning for Heart Month. In fact, this morning came out this new study that found drinking 3 cups of coffee a day can cut your risk of having a heart attack by 1/3. Of course, there's a lot to dig into with that one that we won't get into.
I'm going to have to read that article.
Yeah, we'll have to get into that at some other time because there's a lot going on with that one, and some of it is rather dubious. But we do have things to talk with you about that we do know about heart health, and that is that it's important for everyone. Doesn't matter what age you are. Watching out for your heart health is really important, isn't it?
Absolutely. We use the month of February to really highlight the importance of not only heart health, but prevention. So doing those things that really, bring an overall health consciousness to the forefront and doing things to help prevent cardiovascular disease before they even occur.
One of the things that is out there is this term at risk. When you are at an elevated risk of heart disease, of heart attack, how do we know, Melissa?
Well, I think, the biggest factor is a family history. So many people come into our outpatient office talking about their brother, their mother, these close family members who have been affected by cardiovascular disease. And we know that places an increased risk for the individual as well. So being aware of your family history is, of course, key in identifying risk for heart disease. But then there's other factors, and we've talked about those before, but those are things like high blood pressure, diabetes, smoking, high cholesterol. All of those factors can also increase your risk of developing cardiovascular disease.
And one of the things about that is all of them are controllable, and in fact, they're things that you can eliminate from your lifestyle.
Absolutely. And, with the craziness of 2020, people have been afraid. They've been afraid to go to the hospital, afraid to go to their primary care doctor. So some of those just basic foundations of health have kind of got lost over the past year. So we're really trying to increase awareness. All of the IPG offices are really doing everything they can to make patients feel safe, offering telemedicine appointments, just trying to get the patients in and getting all of those risk factor screenings taken care of and caught up. So that's a big focus moving forward for 2021.
It's pretty dangerous to skip all that stuff, isn't it?
Absolutely. If you don't know, you don't know, right? So you really need to get a jump on those things early. And so as an entire organization, we're really focusing on getting those screening things back into play for patients all across the county.
Now, you mentioned telemedicine a couple of moments ago, and it became really, really big once the pandemic hit, and so very, very important. There are things that within cardiology as well as with any other branch of medicine that you absolutely have to be there in person, but you can do a lot through telemedicine, can you not?
Absolutely. I mean, just a check-in for just basic health, see how things are going, discuss symptoms. A lot of that can be done via a video conference or a telemedicine telephone visit, just to continue that conversation with your provider, whether it's your cardiologist or your primary care doctor.
What are some of the questions someone might be asked during one of those visits?
We're focusing a lot on, general health. So are you staying active? What kind of exercise program do you have? What's your diet? Really focusing on those kind of things. Exercise has taken a big hit in the past year. Gyms have been closed. People just haven't been able to get out and be as active as maybe they once were. We're super excited. Our S&T Wellness Center just recently reopened, so that has been a huge avenue for patients to get out and get active. So, we're talking about those kind of things a lot on telemedicine visits.
Yeah, and so that being the case, hopefully we've convinced somebody that telemedicine might be just the thing that they need. How does someone make a telemedicine appointment through IPG?
The IRMC.org website has all of that information. They can get you in contact with our scheduling center. We have a centralized center that can connect you to any of the IPG offices and arrange for those telemedicine visits.
Yeah. Now, there are events during Heart Month. There always are. We don't have the giant inflatable heart we can walk through this year.
Nope, not this year.
but there are still things going on. What are some of the events that IRMC has put together for Heart Month?
Well, in the tradition of the 2020 Zoom meeting, we are doing a virtual event with our newest cardiologist. Dr. Linton Frazier joined us about a year ago, and her specialty is really in preventative health as well as the electrical system of the heart. So she's doing a virtual Zoom event just to discuss women's health, and she'll also be doing a modified Pilates class on that event. So anyone interested in that can jump onto the website, irmc.org, to sign up, RSVP, and get all of those details. And again, in the mindset of preventative health, we're also doing a free blood pressure clinic at Giant Eagle in their parking lot on Sunday, February 21st. So from 2 to 5, you can come on out, do your grocery shopping, and then stop by the IRMC RV for your free blood pressure screening.
That's a good idea, because you're right. If somebody has been neglecting that stuff for a year or so because of the pandemic, and we understand that certainly is going to be the case for some folks, and now's the time to start reining that back in and get back.
Absolutely.
Get back to doing it right. All right. So, Melissa, we're talking, by the way, with Melissa Duncan, with physician assistant with IPG Cardiology. Melissa, there's always a connection made between diet and exercise. You hear it all the time. Diet and exercise, diet and exercise. They're both very, very important. So let's start with diet. What is a heart-healthy eating plan? What are some of the foods that are going to help us in terms of our heart health? And where can we get the resources to learn, okay, this is what I should be eating and this is what I shouldn't?
There is so much information. I mean, all you have to do is type it into Google, and you're absolutely inundated with information about diet. But I think the key points are keeping everything in moderation. So overindulging in anything can be a problem. Watching those saturated fats. Some of those things we all learn as kids, but it's really easy to ignore. And then, I mentioned the Wellness Center, the S&T Wellness Center earlier, and a lot of people don't realize they have great nutrition support there. So they have nutrition counselors available. If people are really interested in getting more aggressive with a modified diet, that's a great resource available here in the community.
Yeah, we think of the S&T Wellness Center as an exercise facility. People can go in and people say, okay, do this, and this is how you work this machine, and this is how you avoid tensioning your back or anything, but the nutritional aspect of it is just as important.
Yeah, I think a lot of people recognize the exercise component there, and that's really taken off and been wonderful, but I can't understate the importance of that nutritional counseling. There's some great educators over there willing and available to help.
All right, so let's get on the elliptical or the treadmill or whatever we're getting on and talk a little bit about exercise. It doesn't take a great amount of equipment or expense in order to take a walk. Certainly.
Absolutely. No, we're not asking anyone to become a marathon runner. In fact, we're maybe the exact opposite. The studies have shown that it's really basic aerobic exercise for about 30 minutes, 4 to 5 days a week that can be beneficial to heart health. And when we talk about aerobic exercise, we're really just referencing anything that raises the heart rate and keeps the heart rate up for about 30 minutes. And that can be as simple as a brisk walk around the block.
Mm-hmm. Yeah, so it doesn't have to be expensive at all. However, there are great programs, and you mentioned the S&T Wellness Center and what they're able to do for you in terms of setting you up with that and making sure that you're doing things that are going to be good for you and good for your heart health. A couple of moments ago, you also mentioned just some of those other risk factors in addition to heredity and family history, and I want to talk about that for a second. Obesity rates continue to climb, unfortunately, here and all across the Commonwealth, and really across America. Obesity has become such a big problem, and it really taxes the heart.
Absolutely, and obesity also leads to those other factors like high cholesterol, high blood pressure, and diabetes. So, I'm getting back to that exercise again, but doing those things that you can do with diet and exercise to really get ahead of that weight before it kind of spirals out of control is an absolute factor.
You mentioned smoking as well. Is vaping a part of that as well? I know the studies are out there, and they are coming in all the time now about the effect of vaping, but does that affect your heart in the same way or in a way related to smoking?
It does. We're still learning. Vaping is so new. We're still learning more and more about it daily. And we know that traditional cigarette use is a major factor for developing coronary artery disease and increasing the risk for heart attacks. And we're still learning how vaping plays a role as well. The data looks like it's maybe less of a risk factor, but it doesn't take it away completely. We're also seeing vaping have other effects on rhythm abnormalities and things that we're just starting to identify.
We've been talking about prevention mostly, but there are therapies as well involved when someone does have a heart event, whether it's bypass, stents, or just the development of heart disease. There are therapies that can really help you to recover a bit of the lifestyle that you should be living anyway.
Absolutely. IRMC is so proud of our cardiac catheterization laboratory here. That's something that we developed in partnership with Butler Health System, and we just have an amazing team of interventionalists here working in the cath lab daily to provide some of those therapies like stenting you mentioned. And we're constantly in conversation about how we can expand that partnership and what other options we can offer to the community. So that's a constant conversation here, and I don't think we have anything definitive there yet, but I'm hoping over the next year maybe I'll be back on here on the radio with you again talking about some of the other offerings we're going to have for the community.
Yeah, well, let's hope it's not a year. Because the cath lab has really changed the game here in Indiana County, hasn't it?
Yeah, I think I've been here 12 years practicing at IRMC, and I think that is first and foremost the most exciting development we've had here. It has completely changed our ability to provide immediate care, life-changing care for the people of Indiana County. All
right. We've been talking with Melissa Duncan here during Health Month. Melissa, you mentioned Dr. LaToya Linton-Frazier and her Zoom event. When is that? And again, how do people get in on it?
It is the week of February 21st, and forgive me, I believe it's on the 23rd, but I don't have the exact date. But all of the information is available on irmc.org. Look for the link for the virtual Zoom events there, and it'll give you all the information. Again, she's going to be discussing heart health, preventative health, and also offering a modified Pilates class, giving the community some modified exercise techniques that they can use at home.
And, of course, February 21st, Giant Eagle for the free blood pressure clinic. Melissa, thanks so much for being with us.
Thank you. Have a great day.
You too.
Day.
You too.